Good evening, the good people of Ghana, Africa, and of the world. We are yet again on Global Health Update on Donde1 TV and Dr. Ibrahim Seko TV on YouTube. This is the 1st June 2020 edition. As we promised on the 31st May 2020 edition, when we're talking about the COVID-19 and the child, part 2, where we talked about the multi-inflammatory syndrome in children related to COVID-19. We promised that after that program we will talk about the COVID-19 and the human heart, the cardiovascular complications of COVID-19 on the human heart, the cardiovascular complications of COVID-19 on the human being. Without much ado, we zoom in onto this evening's program. So as I just said, 1st June 2020 Global Health Update, COVID-19 and the human heart. That is the effect of COVID-19 on the cardiovascular system or the human heart. Now, let's give a brief definition of COVID-19 vis-a-vis cardiovascular system. Now, COVID-19 is a spectrum disease spanning the gamut from asymptomatic infection to critical illness. Reassuringly, for the large majority of individuals infected with the new coronavirus, the ailment remains mild to moderate range and majority recover, as we already know. Now, what has borne the brunt of the disease is the damage to the lungs. That is what we have. But as the weeks and the months have come to pass, we have realized that COVID-19 has got serious implications on the heart. Either somebody has got a pre-existing heart condition that is made worse, or there is through the infection there is a cardiovascular complication, and that is what today's program is all about. So, as I said, lung injury and acute respiratory distress syndrome have taken a center stage as the most dreaded complications of COVID-19 ever since its inception in December 2019, right from Wuhan in China. The disease, that is COVID-19, the disease that is caused by the new coronavirus, SARS-CoV-2. But heart damage has recently emerged as yet another grim outcome in the virus's repertoire of possible complications. A number of those infected develop heart-related problems, as I said, out of the blue or as a complication of pre-existing cardiovascular disease. Now let's do some statistics. In the course of the program, there will be a little bit of statistics because one hospital in, say, US has done some investigations. Another hospital in, say, China has done some investigations. So there will be a little bit of statistics popping up here and there. So let us sit and then relax and then listen to Donde1 TV and Dr. Ibrahim. A report from early days of the epidemic described the extent of cardiac injury among 41 patients hospitalized with COVID-19 in Wuhan, China. Now, 5 of these 41 patients, constituting about 12%, had signs of cardiovascular damage. What we are trying to say is, of the 41 patients in Wuhan, 5 of them, that is 12% of them, had cardiovascular damage. Now, these patients had both elevated levels of what we call the cardiac troponin, which is a protein released in the blood by an injured heart muscle, and abnormalities found on a heart ultrasound called electrocardiogram. Since then, other reports have affirmed or confirmed that cardiac injury can be part of coronavirus-induced harm to patients. Moreover, some reports detail clinical scenarios in which patients' initial symptoms were cardiovascular rather than respiratory in nature. That means that even though right from the beginning we knew that when it comes to coronavirus, a lot of the presentation has been sneezing or coughing, which constitutes a respiratory correlate. But certain patients have presented right from the beginning with cardiovascular complications, so that the respiratory component was initially missing. Primarily considered life-threatening for its effect on the lungs. A new study published in April-May in JAMA Cardiology finds COVID-19 can also cause heart injury even in people without any underlying heart diseases. We know that the cardiac injury risk is there, no matter if you had prior heart disease or not. So prior heart disease is a risk factor for higher mortality in patients attacked with COVID-19. And then cardiac injury itself also is a risk factor. But this can happen to people who are free of heart disease. One Dr. Mohammed Majid, this research team's lead author and assistant professor of cardiology at McGovern Medical School at UT Health, could confirm this development. How does the new coronavirus cause cardiac damage? How does this new coronavirus cause cardiac damage? Now, the ways in which the new coronavirus provokes cardiac injury are neither that new nor that surprising, according to the Harvard Medical School physician scientists Peter Libby and Paul Ridker. The part that remains unclear is whether SARS-CoV-2, that is the virus that causes the new coronavirus infection, that causes the COVID-19, is somehow, the part that remains unclear is whether the SARS-CoV-2 is somehow more virulent towards the heart than the other viruses. Now, Libby and Ricker, the two scientists who have delved into how the coronavirus, who have delved more into how the coronavirus causes cardiovascular complications in humans, continue to say this. Now, before we continue, I want our audience to know that Libby and Redka are practicing cardiologists at Brigham and Women's Hospital. Now, they say that COVID-19 related heart injury can occur in any several ways. We have about 4 ways. So second, people with previously undiagnosed heart disease may be presenting with previously silent cardiac symptoms unmasked by this viral infection, COVID-19. In people with existing heart vessel blockages, infection, fever, and inflammation can destabilize the previously asymptomatic fatty plaques. Now, fever and inflammation also render the blood more prone to clotting, while also interfering with the body's ability to dissolve these same clots, which is a 1-2 punch akin to throwing gasoline on smoldering embers. It's like one big stress test for the heart. This coronavirus has really caused mayhem in the medical field. Now, third, some people may experience heart damage that mimics heart attack injury, even if their arteries lack the fatty calcified flow-limiting blockages known to cause classic heart attacks. This scenario, called myocardial infarction type 2, can occur when the heart muscle is starved for oxygen, which in the case of COVID-19 may be triggered by a mismatch between oxygen supply and oxygen demand. Now, fever and inflammation accelerate heart rate and increase metabolic demands on many organs, including the heart. That stress is compounded if the lungs are infected and incapable of exchanging oxygen and carbon dioxide optimally. This explains one of the reasons for massive deaths in a lot of patients around the world. Now, this impaired gas exchange, that is oxygen coming into you by inhalation and then carbon dioxide being exhaled, this impaired gas exchange can further diminish oxygen supply to the heart muscle itself, That is what? It is going to cause myocardial damage. Now finally, the fourth one. There is a subset of people with COVID-19, some of them previously healthy and with no underlying cardiac problems, who develop fulminant inflammation of the heart muscle as a result of virus directly infecting the heart itself. Now, this type of inflammation could lead to a type of heart rhythm disturbances and then cardiac muscle damage, as well as interfere with the heart's ability to pump blood optimally. The propensity of certain viruses to attack the heart muscle and cause viral myocarditis is well known. Now, myocarditis is the inflammation or infection of the heart muscle itself. The most notorious viral offender in this case is a virus called Coxsackie B virus. Now, nonetheless, a recent case report from Italy underscores one of the epicenters of the coronavirus outside China in the initial stages of the pandemic. Italy underscores the notion that the new coronavirus could also infect the heart and affect heart muscle function in otherwise healthy adults, even after acute phase of the infection has resolved, and even in the absence of lung damage. There are definitely some people who develop acute fulminant myocarditis. When we say fulminant, that is very severe. Fulminant myocarditis, in which the virus infects the heart muscle itself or the cells within the heart and causes a horrible inflammatory reaction. This can be life-threatening, and it can happen in people who don't have any pre-existing risk factors. However, this out of the blue scenario in otherwise healthy individuals is likely rare relative to the overall number of people with COVID-19 who experience heart problems. The cardiac involvement in COVID-19 is yet another striking example of the widespread effect of the inflammation on multiple organs and systems. Inflammation is a critical defense response during an infection, but it is also a dark side. It has also a dark side. Now, infections can set a cascade of immune signals that can affect various organs of the body. Now, these researchers, the cardiologists Libby and Ritka, hypothesize as follows: that any infection in the body, for example, a festering boil, an injured joint, a virus, can become a source of inflammation that activates the release of inflammatory proteins known as cytokines, that is cytokines, cytokines, and calls up armies of white blood cells, lymphocytes, and other messenger molecules that, in an effort to fight the infection, disrupt the normal processes. When these inflammatory molecules reach the welcoming soil of fatty deposit in the blood vessel wall, one that is already started with resident inflammatory white blood cells, the cytokines can boost the local inflammatory response and trigger a heart attack. Cytokines can impinge on these cells in the plaque, that is a fatty plaque, blocking the blood vessel, and push it through a round of further activation. The inflammatory chemicals released during infection can also induce the liver to ramp up production of important proteins that defend the body from infection. These proteins, however, make the blood more prone to clotting, while also reducing the secretion of natural clot-dissolving substances. Now, the tiny clot may clog the small blood vessels in the heart and other organs such as the kidneys, that is arteriosclerosis, and may affect the kidneys, depriving them of oxygen and nutrients and setting the stage for multi-system organ failure that occur in the acute infection. Now, thus, immune-mediated injury to the heart and other organs could also be collateral damage because of the body's overwhelming systemic immune response. And this is a condition we call the cytokine storm, which is marked by widespread release of cytokines that cause further cellular demise, tissue damage, and then organ damage. Now, a stage of this program, I want us to look at this COVID-19 and blood pressure medications. When you have high BP, when somebody's BP is 150/90 or more over a prolonged period, you are put on antihypertensives such as calcium channel blockers such as nefelipine, beta blockers such as atenolol, angiotensin 2 receptor blockers such as the ACE inhibitors such as lisinopril and all that. The ACE inhibitors such as lisinopril and all that. Now, it has been found that there is a certain relationship between the COVID-19 and these blood pressure medications. Now, let's zoom in on this. SARS-CoV-2, that is the virus that causes COVID-19, invades human cells by latching its spike protein onto the angiotensin 2 receptor found on the surface of cells in the airways, the lungs, the heart, the kidneys, and the blood vessels. Now, I repeat. The SARS-CoV-2, that is the virus that causes coronavirus infection and all that, invades the human cells by latching its spike protein onto the receptors that the blood pressure medicines attach to. In this case, the ACE2 receptor found on the surface of the cells of the airways, the lungs, the heart, the kidneys, and the blood vessels. Now, this ACE2 protein is an important player in the what we call the renin-angiotensin-aldosterone system. Now, there's this mechanism in the kidney that helps in controlling blood pressure. We call it the renin-angiotensin-aldosterone system. Now, this system regulates blood pressure, vessel dilation, blood vessel dilatation, and then blood pressure. Now, two classes of drugs widely used to treat high blood pressure and heart disease, that is ACE inhibitors and angiotensin receptor blockers, interact with the ACE2 receptor. A possible concern related to COVID-19 stems from the notion that these blood pressure medications could increase the number of ACE2 receptors expressed on these cells we talked about. That is the airways, the lungs, the heart, the blood vessels, and the kidneys, possibly creating more molecular gates for the virus to enter. So while these blood pressure medicines are working, the COVID-19 may take advantage and enter through these gates to go and cause more effect. It is early days yet. Now, some experts have wondered whether the use of such drugs could render people who take them more susceptible to the infection. For the same explanation I just mentioned. Now, conversely, others have postulated that the abundance of ACE2 receptors may enhance cardiovascular function, exercising a protective effect during the infection. That's the COVID-19 infection. The answer is far from clear, but a recent review suggests these medicines may play a dual role in COVID-19. On one hand, enhancing susceptibility to infection because the virus may pass through the gates that the medicines pass through to affect these ACE2 receptors, and on the other hand, protecting the heart and ameliorating the lung damage from the disease. A two-pronged effect, one good, one bad, so to speak. Now, these same cardiologist researchers delving into the effect, the relationship between COVID-19 and its correlates on the heart or cardiovascular diseases. Continue to say, now they caution that patients who take such life-saving medications should stay on them, or at least have a careful discussion with their cardiologist once a while, so that if somebody gets COVID-19 and has got a heart condition, they must visit their cardiologist, they must visit their doctors regularly. If there's any change in them, they should visit their doctors regularly, so that they don't suffer from the COVID-19 enhanced effect on whatever the heart disease they have. This is because these drugs have clear and well-established benefit in hypertension and certain forms of heart disease, while their propensity to make humans more susceptible to SARS-CoV-2 remains speculative for the time being. So it is, as I said, it is early days yet, but as we keep saying, it is the information, the data on the patient coming up that will modify our knowledge and hypothesis, converting them into what is an acceptable norm in the medical field. So for now, whether SARS-CoV-2 in conjunction with the ACE2 receptor blocker medications have a role to play in making people susceptible to the more virulence that SARS-CoV-2 displays to patients with the COVID-19 infection and who also have hypertension and other cardiac correlates. But what remains speculative today will crystallize in the weeks and months to come, Ritka and Libby said, because the science is moving forward rapidly. As I said, with new papers coming out daily and a growing pool of patients to draw observations from. Now, in 12 to 18 months, we are going to have a great deal of information. But right now, our job is to, number one, keep people from getting COVID-19 by strict adherence to now familiar containment measures. Then we need to get people who get the disease through this acute phase. The need for rigorous randomized trials done quickly and effectively is acute, they said. Until the evidence from these trials begin to coalesce, clinicians will have the Herculean task of having to navigate the uncharted territory of delivering cardiac care in time with caution, but also with resolve. We don't have the comfort of our usual databases, so we have to rely on our clinical skills and judgment. But we have to do in all humility, because often data don't bear out our logical preconceptions. So it explains all what we are saying. Now, I want us to look at this school of thought. Now, the risk much higher for pre-existing heart conditions. I want us to look at some studies done in the same Wuhan. Now, this time, Renmin Hospital of Wuhan University in China. They did some studies from January to February 2020. Now, this was based on 416 adults who had coronavirus. Now, let's zoom in on this. A study conducted from January to February 2020 this year used data from 416 adults confirmed to have had COVID-19 and hospitalized at Renmin Hospital of Wuhan University in China. Now, cardiac injury was defined by elevated levels of a protein called the troponin, as I mentioned earlier on in this presentation, which is measured in the blood. However, one Dr. Srinivas Gudimetla, a cardiologist at Texas Health Fort Worth and Texas Health Physicians Group, a cardiologist at these two hospitals, explains that detecting abnormal troponins in a critically ill patient with COVID-19 isn't likely to alter the management of the patient. Without a vaccine for a cure from the infection, only aggressive, supportive care can be rendered, such as maintenance of blood pressure, making sure that the blood pressure does not go high, treating heart failure with drugs, that is treating the heart failure with heart failure drugs, treating secondary infections with appropriate antibiotics, support of renal function, making sure that if there is anything that is damaging the kidney, we put a stop to it and then we control any, prevent any further kidney function, any kidney malfunction, and then support the respiratory status. Now, if there is any drop in oxygen saturation, we have to give oxygen, use of ventilators. The findings also show that there was a much higher death rate among patients with cardiac injury compared with those without cardiac injury. Now, whooping 51% of the patients with existing cardiac injury died versus only 4.5% of those without. Now, another school of thought is this: concern over heart failure, drugs may worsen symptoms. Concern over heart failure, drugs may worsen symptoms. So what we are saying is heart failure drugs may also worsen the symptoms of the COVID-19 patients with heart conditions. Now let's zoom in on this. Now this is more about researches because we are still in the early days of the pandemic. More researches have to be done so that a lot of knowledge will be churned out that will help prune our knowledge in cardiology, our knowledge in managing infectious diseases, so that we'll get to know the balance between treating COVID-19 and then those with heart conditions who get COVID-19 safely. Now, research published in the American Journal of Emergency Medicine in May this year found that 24% of COVID-19 patients were experiencing acute heart failure when first diagnosed with the virus. The authors state that it is unclear if the heart failure was caused by the COVID-19 or if the virus had worsened the undiagnosed heart failure. It is currently unknown if heart failure is due to new cardiomyopathy. We have mentioned this snippet of this earlier. A condition that can lead to the heart failure versus an exacerbation of previously undiagnosed heart failure, the authors wrote. Now, one Dr. William Brady, one of the study's authors, said that as more experience is gathered treating the COVID-19, we will continue to learn more about the COVID-19 and the most optimal means of managing its many presentations. The researchers added that the researchers also addressed potential drug interactions in these patients. According to the study, the good old hydroxychloroquine is a treatment option that has been put on the table that can interact with medications used to regulate heart rhythm. It could also cause heart damage and worsen cardiomyopathy. So this explains why World Health Organization is similarly trying to withdraw this hydroxychloroquine. You understand? In as much as hydroxychloroquine and other antibiotics can help treat the COVID-19, this same hydroxychloroquine can interact with medications that are used to treat or regulate the heart rhythm. Now, this same hydroxychloroquine can cause heart damage and can worsen cardiomyopathy. Now, the authors note that remdesivir, that is an antiretroviral, that's the only COVID-19 treatment authorized by the FDA, can cause low blood pressure and abnormal heart rate. Now, earlier on yesterday, we talked about the fact that there is this multi-system inflammatory syndrome in children associated with COVID-19, and we said that because of the massive immune response, it may cause low blood pressure. Now, for patients who are put on this remdesivir, that has been approved by FDA to treat COVID-19. This same remdesivir can also cause low blood pressure. So it can further, if a child has got this, a teen has got this, how do you call it, this coronavirus and has got a heart correlate and is given a remdesivir, it can reduce the blood pressure more and then further cause abnormal heart rhythm function. But when they get the doctors know how to cross the bridge, there's a lot that has to be done. Doctors have Herculean task ahead of us. Now, some of the medications utilized to treat COVID-19 also have potential cardiac complications. The authors noted, it is important for the emergency clinicians to be aware of these complications when treating a COVID-19 patient. Now, COVID-19 recommendations for people with heart disease, released by the American College of Cardiology. COVID-19 recommendations released by the American College of Cardiology for people with heart disease. Now let's zoom in on this. The American College of Cardiology released a bulletin advising healthcare providers how best to deal with the cardiac risk presented by COVID-19, and this include the following. Now, 1. Make plans for quickly identifying and isolating cardiovascular patients with COVID-19 symptoms from other patients with COVID-19 who don't have cardiovascular conditions. 2. Patients with underlying cardiovascular disease are at higher risk for developing COVID-19 and have a worse outlook if they get a COVID-19. 3. Advise all cardiovascular patients of the potential increased risk and encourage additional reasonable precautions. It is important for people with cardiovascular disease to remain current, that is number 4, with vaccinations, especially for influenza and pneumonia, as may be deemed fit. Now, what is the bottom line? The bottom line is this: typically considered a threat to the lungs, COVID-19 also presents a significant threat to the heart, according to recently published researches we've zoomed in on. Now, although people with existing heart disease have a greater risk, a small percent of people with no pre-existing heart issues also experience heart damage from the COVID-19. And experts say it's important for those with cardiovascular disease to be isolated from people with COVID-19 symptoms and to remain current with vaccinations, as we have said, for influenza and pneumonia. In the next few minutes, we'll be bringing our discussion on this to an end. Now, let's have another look at the cardiovascular complications of COVID-19. New study warns of COVID-19 impact on the cardiovascular health. A recent study, as I said, it is all about statistics. A recent study shows that a significant number of people who develop coronavirus may experience serious cardiovascular complications, as you have said. Moreover, some possible treatment of the respiratory disease could end up harming cardiovascular health. As they assess data from people who received medical care for COVID-19, researchers recently started paying attention to the relationship between disease and cardiovascular symptoms. You've partly said this. Now, in April this year, the journal Radiology published several studies showing a link between COVID-19 deaths and the occurrence of black clots that impair circulation, an issue that increases the risk for life-threatening medical events. Meanwhile, a review of available evidence indicates that COVID-19 is sometimes associated with serious cardiovascular outcomes, including heart failure, heart attacks, as well as black clots. In writing this publication, or as at the time we are giving this doing this presentation to you, we hope to increase emergency physicians' knowledge and awareness of this new pathogen and its impact on the cardiovascular system. Now, Dr. Brady adds that as we encounter more and more patients with COVID-19 related illness, we are increasing our understanding of its impact on the body in several ways, and also the cardiovascular system in particular. The rate of learning on this area is amazingly rapid. Dr. Brady and colleagues report their findings in a paper that appears in the American Journal of Emergency Medicine. Now, what are the secondary impacts of COVID-19 pandemic on patients with heart failure? Now, this was originally published 30th April 2020. In a publication online, sec.heartfailure.120.007.219 circulation, heart failure .20:13. So, secondary impact of COVID-19 pandemic on patients with heart failure. The novel coronavirus disease 2019 pandemic has presented two sets of challenges to heart failure community. Time and again. First, we were forced to rapidly establish best practices for the care of patients with heart failure and COVID-19 and to manage its cardiovascular complications. Although health systems around the world have been immediately and appropriately focused their energies on mitigation, we must prepare for the second wave of challenges ahead. That is the consequences of disruptions in heart failure care in patients, provider and system levels. So the patient level, the provider, that is the hospital level, and the systems level. When we say systems level, like for example, is there a system of health insurance, or is this a system of cash and carry and stuff like that? Vis-a-vis patient and provider. Now at the patient level, by April 2020, an unprecedented 12 million Americans had filed for unemployment benefit. Now, when it comes to the unemployment benefit, a lot of indigents and citizens in the Western world, for example, America included, have filed for unemployment benefit. Now, poverty and unemployment and their attendant consequences like loneliness and isolation are associated with increased risk for cardiovascular morbidity and mortality. Now, we can anticipate that this economic upheaval will result in enormous numbers of patients with heart failure becoming underinsured and unable to afford for their life-sustaining and life-saving therapies. Pre-existing health inequalities are being magnified by this COVID-19 pandemic, and underrepresented minorities are suffering the disproportionate burden of devastation. During this time of the pandemic, the physical separation of patients from their caregiver teams may further exacerbate this socio-economic deprivation. Changes in dietary and lifestyle behaviors during the social isolation, like increased processed food and alcohol consumption and decreased physical activity, may trigger heart failure destabilization. Heart failure destabilizations, amplifying the messages that those with chronic conditions should practice social distancing and stay home may confuse and frighten patients with heart failure, leading them to delay evaluation for advanced congestive or low output systems and suffer worse outcomes. Alternatively, patients with progressive symptoms, either due to COVID-19 or underlying disease, may choose to stay at home with family rather than risk dying isolated in the hospital. A multifaceted approach will be critical to overcome this crisis. Now, in-person and virtual remote care services are of high value. The capacity for and consolidation of home visits, during which providers check vital signs and weight, perform blood draws, administer intravenous diuretics, and deliver precautions should be rapidly scaled. This pertains more to the Western world. We come to Ghana. We'll say a little bit for Ghana when we get to the Ghana session. Patients should be proactively enrolled in telehealth programs and equipped with physiological monitors that can communicate information to healthcare providers. Clinicians should yet again incorporate targeted cautioning regarding changes in food stability, alcohol consumption, psychological health, physical activity, caregiver support status in their assessment, and should regularly reinforce the indications for seeking medical evaluation. Now, palliative care and hospice services need to be expanded in peril. Unfortunately, socioeconomically disadvantaged populations are less likely to have access to and therefore benefit from this intensification of remote care and may endure disproportionate cardiovascular morbidity and mortality. So sad. Effective alternative outreach initiatives for these populations are urgently needed. In effect, what we are trying to say is, because of the fact that when managing COVID-19, a lot of economies following World Health Organization protocols may have to do institute quarantine or self-quarantine, institute isolation mechanisms. Now, before the pandemic got worse, there was there was panic shopping and all that. And when it comes to domestic items, they were short in supply, including pharmaceutical produce. People had to go and buy the medicines far more than they needed. And so people with heart conditions and all that with sociological or socio-economic issues will have difficulties accessing this. Even if there are remote services that are at their disposal, because of socio-economic problems, they may not be able to access. And that will worsen their heart conditions, or may worsen their COVID-19 cardiovascular correlate conditions. Now, what is Ghana's situation as far as COVID-19 and its cardiovascular correlates are concerned? Now, this is too prone. First, we'll look at Nanado's speech in brief. We'll be dealing with Nanado's speech, 10th speech. We'll be breaking it down into its various level. But this one is just an aspect of it that relates to the heart that he mentioned in his speech. And then the second one has to do with FDA in conjunction with the celebration of No Tobacco Day on the 31st of May. Some statistics that have been raised, the fact that the youth have been advised against smoking and all that. Now let's zoom in on the Ghana situation vis-a-vis COVID-19 cardiovascular correlate. Now, diabetics, hypertensives. Now, diabetes and then hypertension are associated with COVID-19 deaths. Now, this was highlighted in President Nana Akufo-Addo's 10th speech on COVID-19 when he was addressing the nation on Sunday, 31st May. Now, President Nana Akufo-Addo has revealed that most COVID-19 deaths in Ghana have underlying health conditions such as diabetes and hypertension, as has always been the norm. He made this known as he delivered his 10th address to the nation on Sunday, 31st May 2020 at 10 p.m. He has therefore called on persons suffering from diabetes and hypertension to take their treatment seriously. He also reiterated his call on all Ghanaians to improve their fitness level by exercising and then by eating local diets that were rich in appropriate nutrients. He said that it is critical that Ghanaians improve their fitness level. Now, the second part is the celebration of the No Tobacco Day on 31st May, where some statistical information has been given concerning the fact that 500,000 smokers risk contracting coronavirus. Food and Drug Authority has warned the nation as the country celebrates World No Tobacco Day. Now, more than 500,000 people in Ghana are estimated to smoke cigarettes on a daily basis, and other tobacco users are at higher risk of contracting COVID-19 and succumbing to it, the FDA has warned. Now, this is because the hand-to-mouth contact during smoking and sharing of the mouthpieces of these cigarettes and shisha tubes, shisha, that is SHISHA tubes, could easily aid the spread of the COVID-19, while the weakening of the lung due to the smoking makes it difficult for the body to fight the virus back. Now, the FDA has therefore cautioned all smokers, especially the youth, who are fond of using innovative forms of tobacco smoking like shisha, to quit or stop smoking in public places, because even by so doing they are endangering the lives of the secondary smokers. Now, secondhand smokers are persons who do not smoke but inhale a combination of smoke from the burning ends of the cigarette and the smoke breathed out by the smokers. This is a double-edged sword. The head of Tobacco and Substance Abuse Department of FDA, Dr. Mrs. Olivia Boateng, made a disclosure when she spoke with the media ahead of this year's World No Tobacco Day, which was marked on 31st May this year. Now, the World Health Organization and global partners on every 31st May mark the World No Tobacco Day to raise awareness on the deadly effect of tobacco use and the secondhand smoke exposure, as well as to discourage the use of tobacco in any form. Now, the theme for 2020 edition is protecting the youth from industry manipulation and preventing them from tobacco and nicotine use. As of yesterday, that is 31st May, Ghana had recorded 7,881 cases of COVID-19, with 36 deaths and nearly 2,540 recoveries. Now, Dr. Boateng explained that a review of the studies by public health experts convened by World Health Organization on April 29th this year confirmed the higher risk of smokers to COVID-19 aside other respiratory diseases. I repeat, Dr. Boateng explained that a review of studies by public health experts convened by World Health Organization on April 29th this year confirmed that the higher risk of smokers to COVID-19 aside other respiratory diseases. The act of smoking meant that fingers and possibly contaminated cigarettes are in contact with lips, which increases the possibility of transmission of the COVID-19 from hand to mouth, she said. Giving details of the data on smokers, she said 500,000 daily cigarette smokers figure was estimated by the Tobacco Atlas Ghana, and that it included more than 425,000 men, 69,200 women, and then 2,700 boys. On prevalence among the youth, she said that per the Global Youth Tobacco Survey, Ghana Fact Sheet 2017, 8.8% of boys and 8.1% of girls in the country currently used any tobacco product, which is very serious. The youth, who are the future leaders, are being destroyed by tobacco. And may God forbid if they get COVID-19, you can presume the prognosis of their disease. That is very serious. Very, very serious. The survey further revealed that some preferred electronic cigarettes in this category had 4.9% of students, out of which 4.9% were boys and 5.0% were girls. She said yet again that tobacco killed more than 8 million people globally every year, out of which more than 7 million were from direct tobacco use and around 1.2 million are due to non-smokers being exposed to secondhand smoke. So this is an advice to all of us. When somebody is smoking, don't stand there. You may be a husband or a spouse. If your partner is smoking, don't say that I love you, so you stay in the smoke. Because 1.2 million people are being killed by secondhand smoke from tobacco use. This is very serious. This is very serious. Now in Ghana, she said, that is Dr. Boateng, smoking of cigarettes alone killed 75 men weekly. That is very serious. 75 men weekly. Dr. Boateng yet again added that market surveillance, enforcement of the ban on tobacco advertisement, high registration tobacco product fees, and public smoking had helped to reduce the prevalence to a large extent, but the authority, that is FDA, would need collaboration and more resources to reduce it drastically. So we beg the Nana Akufo-Addo government to come to the aid of FDA to provide them with the necessary resources to be able to fight against some of these seeming malpractices with respect to tobacco use in Ghana. Now, concluding, when it comes to the prevention of COVID-19, it is the same old story, which is very important. Your face mask, social distancing, washing the hands on the running water with soap, hand sanitizing regularly, appropriately, good health care. Slightest sickness, go and visit your doctor. If you have heart condition, visit your cardiologist or your doctor. Avoid smoking. Exercise. Listen to President Nana Akufo-Addo. Listen to your doctors. Listen to your healthcare professionals. And then good nutrition. Now with this, we shall all succeed and fight against COVID-19. Now next will be the scientific basis of face mask in controlling COVID-19, and then the strict analysis of President Nana Akufo-Addo's 10th update on COVID-19. Until then, we'll meet again. Bye bye.